Mouth rinsing can be great for oral health, but all mouth rinses are not equal. There are different rinses for different issues. If you have dry mouth, for example, you'll want to stay away from a rinse that has alcohol because alcohol can dry out your mouth even more. You will also want to stay from a rinse that has a pH lower than 7.0. If the rinse is acidic, meaning it's below 7.0, it can actually contribute to cavities instead of preventing them. The choice and order of the rinse you use will depend on your specific need and what you're trying to accomplish. I recommend testing the pH of your mouth and the rinse, especially if you're using bottled water. Some bottled waters have been testing as acidic as drinking a soda. So make sure your mouth rinse is neutral or more on the alkaline side, especially if you're using it to prevent cavities. My name is Sherry Wirtz, and I've been a dental hygienist for over 30 years. I've created Dental Hygiene 411 to help patients, parents, and caregivers figure out what are the best things that they can use to help their family not only make toothbrushing fun, but to prevent disease. Dental disease is caused by bacteria. Bacteria in your mouth that mix with plaque in the food that you eat all day long, that produce an acid and weaken the enamel. The enamel is the hard outer surface layer of the tooth. Cavities are caused by bacteria called Streptococcus mutans. Cavities happen when you have plaque and an acidic environment in your mouth. Removing the plaque and bacteria and controlling the acid are key in preventing cavities and disease in your mouth. You need to physically remove the plaque and bacteria in your mouth with your toothbrush. If you've been following me, you know I talk a lot about toothbrushing. I feel you need to master toothbrushing before you add other products. But as long as we're talking other products, let's talk mouth rinses. Along with toothbrushing, mouth rinsing can reduce bacteria, gum disease, gingivitis, and cavities. You also may need something to get in between, whether it's floss, inner dental brushes, or water pick. We'll save that discussion for later. Today, we're going to talk mouth rinses. Mouth rinses are used for many things that are happening in your mouth, for you and a loved one. Mouth rinses can reduce the bacteria in your mouth, produce cavities, reduce dry mouth, prevent or heal mouth sores. You may need to test what type of bacteria you have in your mouth or in the mouth of your family. It could be crucial to figuring out which product is right for you. Bacterial is familial, meaning it runs in the family, mostly because we drink out of the same glasses, use the same utensils, and kiss each other. Although you can't give someone a disease, you can pass the bacteria back and forth. So mouth rinses, especially antimicrobial ones, can help reduce the bacteria in your mouth. Mouth rinses contain many different ingredients like alum, fluoride, chlorhexidine, green tea, oils like peppermint, tea tree, and eucalyptus. Coconut oil has also been used as a mouth rinse. Therapeutic mouth rinses are over the counter and can be prescription. There are therapeutic mouth rinses that help control plaque, bad breath, gingivitis, and gum disease. Children under the age of 6 should not use a mouth rinse unless supervised by the parent because they might swallow a large amount. Listerine is one of the most popular ones that we see over the counter, and there are over 25 different colors and flavors. There's also Tooth Tonic, Closis, Colgate, Crest, Biotine, Tom's, and the list goes on. You can see the aisle in the grocery store where there's so many choices. How do you know which one is right for you or your family? Well, it depends on your individual needs. Are you preventing cavities? Do you have dry mouth? Are you fighting gum disease? Are you fighting gingivitis? Do you even know the health of your mouth? Visiting your dentist can answer many of these questions. Antibacterial mouth rinses are much more powerful than over-the-counter mouth rinses to prevent gum disease and gingivitis. Even at a most undetectable level, the most common prescription that's given is chlorhexidine, and your dentist recommends it. But it can cause staining, and your dentist will recommend how it should be used for your individual treatment recommendations. You also need to follow the labels for description, uses, dosage, warning, and what you should use as far as what you choose and how you should use it for what you need. If you have any questions, make a comment and I'll be happy to answer any of your questions. I always recommend that you consult your individual dentist or doctor to see what applies to your particular circumstances, because a healthy mouth is a healthy body and a healthy life. If this was helpful, share, like, and subscribe. Have a great day, and happy swishing!